When is all on X not suitable treatment for me? Okay, my name is Dr. Ash, I'm an implant surgeon and I'm here to answer your biggest questions on missing teeth and dental implants. This is a very important question and very close to my heart. And the reason it is as the treatment modality of all on X becomes more popular, what I'm finding is I am getting a lot of patients who are self-referring themselves in that for me are completely unsuitable for treatment. And they want to come in, they want all their teeth taken out and implants put in, which personally, I think it's a dangerous precedent to go down. So generally speaking, there are a couple of parameters which is to do with implants as a whole, whereby you are an unsuitable patient. For example, you may have a very complex immune system where your body can't fight off disease or bugs or foreign bodies and will reject any treatment that we do. So if you're severely immunocompromised, then yes, all types of implants are probably not a great idea. If you have uncontrolled diabetes, uncontrolled gum disease, then again, these are not good starting points to have dental implants. But if we put that to one side and just focus on the all on X treatment, for me, there's a couple of reasons why you may not be suitable. The first one is you literally don't need the treatment because you have enough healthy teeth. If you've watched my video, which was all on X treatment in 3 minutes, I explain in there certain elements of the assessment process. So for me, when I have a patient sat down in front of me and they want an all on X treatment, I individually go through each tooth and I go through what I call a prognosis scoring system. This is split into 3, where I will score the tooth based on what, in my opinion, what its survival is. It can either be good, guarded, or poor. A poor prognosis is a tooth that I know there is no way of us improving. It doesn't mean that we have to take it out there and then, but it means it could be a tooth that's fractured off a gum level that we can't make any better. It has a poor prognosis. A guarded one is a tooth that can go 50-50. If we get involved and we try to improve it, it may survive, it may not. A good prognosis tooth is one that is maintainable for 5 years plus. And to go through individually each tooth really allows us to open up and start looking at the patient's mouth in a way where we're not here to sell all on X treatments. We're here to deliver the best outcome for our patients. So that's the starting point. Based on that, if you've got 9 or more of those teeth in a single arch, then for me, all on X is an unsuitable treatment. It's not something that we're going to offer because we can keep your teeth healthy enough and work around them and provide you with a good solution. If you've got less than 5, then you are suitable. On top of this, if you have issues with your bite, then it doesn't matter how many implants we put in and what prosthetic, your bite can be severely compromised and maybe all on X treatment is not a suitable treatment for you. Okay, so there you have it. Sometimes it's just not the right thing to do, and it's really important that we're treating the patient, not the mouth. If that was helpful, please like this video and subscribe, and I'll see you next time.